Okay, so today I'm going to go over the post-op instructions that we give to all of the patients after extractions. And this especially applies to wisdom teeth. Uh, with the post-op instructions, it's important to read the entire instructions. There's a lot of details on the different snares that can happen. And then also, after your extraction, you're usually given some extra gauze that you'll use to make sure that the bleeding stops. One of the things is rinsing. You usually are not going to rinse for about 24 hours because you don't want the rinse to dislodge the clot. So when you do the rinse, you're going to do the rinse usually using saltwater rinses. You can use Listerine, but that's a little bit too much. So probably saltwater rinses after 24 hours. As far as bleeding, super important to put pressure on the extraction site. And we're going to show in just a little bit where exactly to do that and how to most effectively place the gauze so that there is pressure right on the extraction site. With swelling, you're just going to put some cold or an ice bag on that area that's swelling. That can help with the swelling. And then also, if you're taking one of the non-steroidal anti-inflammatory drugs, that'll also help with the swelling. If there's swelling that is in your lower jaw and you do feel like it's affecting your airway, you do need to be seen at the emergency department just as quickly as possible. The last thing we want is for the swelling to be significant enough where it would block off your airway. Also, if swelling on the maxilla or the upper jaw is significant enough where it's swelling your eye, you usually need to be seen either at the emergency department or here if the dentist office is open as quickly as possible. Usually if we extract the tooth, that will take care of the issue. But if the tooth has already been extracted and you're feeling like there's a lot of swelling happening after that, then you need to be seen at the emergency department. Discomfort, there will be pain management instructions at the bottom of your post-op instructions. If you were seen by an oral surgeon, there's going to be a set of instructions. If you were seen by a general practitioner, there might be some different set of instructions. But baseline, you can go ahead and use alternating ibuprofen and Tylenol. With the ibuprofen, you want to take usually 400 to 600 milligrams, and with a maximum of 2,400 milligrams per 24 hours. And with the acetaminophen, it's a maximum of 300 milligrams per 24 hours. Usually you're taking 500 milligrams at a time, okay? As far as food goes, you just want to be kind around the area. If you're using any tortilla chips or anything like that, it could scrape up against the extraction site, and that's no good. When we do the extraction, sometimes there's a little bit of flouring of the alveolar ridge or the bone around the tooth, and that can cause some bony protrusions. Usually that's not an issue because over 6 months it's going to remodel and become rounded. But if one of them does poke out through the skin, it's usually not a big deal. If it's super discomforting to you, we can go ahead and clip it off. So just kind of keep an eye on those things. As far as infection goes, usually if the tooth was taken out because of infection, we may or may not give you antibiotics. Antibiotics really are for more of systemic infection, meaning you're having postoperative fevers or chills, not really for localized infections. But talk with your provider if you're super wanting the antibiotics, and we can provide those to you, but usually we don't prescribe those to you unless we see a reason for it to be prescribed. Usually with a simple extraction, we're not going to have a post-operative appointment. If there has been a complication or your general practitioner or oral surgeon has requested you to have a post-operative appointment, they will schedule that usually a day or two afterwards just to make sure that you're going in the right direction. So we're going to show here too how to pack the gauze in your extraction site so that it's most effective. So when we're having a tooth extracted, especially wisdom teeth, The key thing is to form the cotton until it's in a small roll so that we can get to the extraction site. A lot of times what we're going to see patients doing wrongly is they'll leave the gauze open like this, and then they'll put it towards the extraction site, and then they'll bite on it. And what happens is when you do this, the tooth actually just bites on the cotton, and then this does not apply any pressure, okay? Versus if we roll this up into a square like this, or into a little ball, and then when they bite down, it's causing pressure on that extraction site, okay? So what we'll do is, let's say that we had our wisdom teeth extracted. We're going to open up, okay? And then we're going to place this as far back as possible, and you're going to actually push it up against the back of your jaw, which is called the ramus, and then you'll go ahead and bite down, okay? You might not be able to all the way close, but if you can feel that, it's mostly on just the extraction site and not at all on the teeth, okay? So that's the way that you're going to do it with gauze. You'll see that the post-op instructions also include instructions for using a black tea bag. That can also have some it has some coagulation factors in there, which will help you stop bleeding. The other consideration too is if you're changing out your gauze quite a bit, a dry gauze can have the clot integrate into the dry gauze, and then when you go to pull the gauze out, you'll pull the clot out, and then it'll start bleeding again. So if that's happening, then what you're going to do is you're going to wet the gauze slightly. And when I say wet the gauze slightly, maybe run it under tap water for just a second or two, then roll it up and then put it in your mouth. It will apply that pressure, but then when you go to remove the gauze, the clot won't be integrated and it'll be able to come out without pulling out the clot. So those are some considerations. Again, if you have any questions, the post-op instructions have all of those directions, so you don't have to remember any of this, what's going on in this video. And then the after hours number is also provided, so that you can get a hold of your doctor if you have any questions, or you can text your doctor through the answering service, through the after hours number, or directly to the office number. Yes. Okay, so we're going to go over, patients will be sometimes concerned about how much blood is too much blood. So we'll kind of go over a couple of scenarios here. So this first example here is, yes, you are bleeding, but it's super manageable. You can see that there's more white than blood. So this is really not a huge concern to us. We also have to understand that the blood will mix with your saliva, so it can look more serious than it actually is. This scenario too, you can see that there is still white on the gauze. So even at something like this is really not a concern to us. On something like this, you can see there is still a little bit of white on the gauze. There might be still a little bit of blood. But if you're changing this out and it's, every half an hour it looks like this, that's not too big of a concern yet. The issue would be is if you have something like this, where you can see that the gauze is not completely soaking up all of the blood, and when you squeeze it, there's blood coming out. And then if you're changing this out quite often, that would be a concern, and that's when you need to make sure that you're using the right technique to put pressure on the extraction site. But if it's continuing to look like this, then you need to call your provider and be seen, so that we can do some procedures to get the bleeding to stop.